Yes, Yashoda.
Okay, so I double checked this slide just now, and actually this is I got it opposite now just now. So this is the smooth muscle in darker shade, and this is the lumen. Okay, so Jana was right. This is actually the smooth muscle layer lah, and this is the lumen, the opposite lah. But this is still the epithelium with the purple colored cells lah, or rather the nucleus of the cells. Okay, so we'll start with the gross anatomy practical. Okay, so first we look at the pelvis. So the pelvis has the inlet and outlet. So this is the pelvic inlet. This is a superior view. If you imagine the superior view of the pelvis, so you can see the pelvic inlet or pelvic brim, and then this is the ilium of the pelvis. This is the anterior superior iliac spine, and this is the pubic symphysis. Okay, so from an inferior view, just to show you the pelvic outlet lah. Okay, from the bottom. Okay, a lateral view of the pelvis. You can see this is, yes.
Did you skip one picture of the pelvic girdle?
Sometimes maybe the sequence is different, but maybe after we finish, maybe you can check lah if I missed any pictures. Okay. So lateral view of the right hip, we have the acetabulum. Okay, this is where the head of femur sits. Okay, and then we have the ischial ramus here and ischial tuberosity here. Okay, and as for ligaments, I think we learned about the ligaments also in MSK, musculoskeletal system, so it shouldn't be new to you. Okay, so we have this sacrotuberous ligament between the sacrum and the ischial tuberosity. Okay, this will then form your your sciatic foramens lah, greater and lesser sciatic foramens formed by these sacrotuberous and sacrospinous ligaments. Okay, I think for sacrospinous ligament you can't see where it inserts, but you kind of can see that it creates the greater and lesser sciatic foramens by this having this sacrotuberous and sacrospinous ligaments.
Doctor, in the dark yellow, are those like nerves?
Yes. Okay. This is sciatic nerve coming out from the greater sciatic foramen. Okay. So this is just showing you obturator internus muscle from here. I think it makes more sense when you do the practical face-to-face because you can kind of orientate the specimens. Here we kind of just take a photo of one angle, so I can understand if it's a bit difficult for you to identify certain things lah. Okay, so maybe if you have a look at the videos, that will give you a better picture of the specimens because we kind of move around or rotate the specimens while we talk lah. Okay, so if we look at the pelvic floor, so you know you have your levator ani muscles, which are puborectalis, pubococcygeus and iliococcygeus, right? So here the puborectalis has been removed. Okay, you can only see your pubococcygeus and iliococcygeus lah. Okay, and this is your anococcygeal raphe, and this is the anal canal. Okay, so inferior view of the same specimen, again your puborectalis has been removed, so you can only see your pubococcygeus and iliococcygeus, and this is the perineal body. Okay, so moving on to the superior view of the pelvis with the muscles as well. Okay, so piriformis, I think this is you learn this in MSK as well. Okay, but this is not part of your levator ani lah. Okay, your pelvic floor, you have this coccygeus muscle here. Okay, and you can only see the iliococcygeus here, which is part of your levator ani lah. So you're supposed to have a coccygeus and pubococcygeus and puborectalis also here lah, which we can't see clearly, so we didn't ask you to label. Okay, so this is iliac.
Doctor,
Yes.
if let's say in the exam, if we label it levator ani instead of iliococcygeus, is it still correct? Because it's hard to tell the difference.
Yeah. Well, usually we will give you a clue lah. Maksudnya say if we wanted one of the levator ani muscles, we will ask more specifically, like state which levator ani muscle can be seen, for example. But if we just say generally, then we have to accept levator ani as an answer lah, because we didn't specify which muscle, right? So yeah, I guess if the specimen is not clear, then we will accept a levator ani lah. But in, say for example, in this specimen here, you can actually see the difference between iliococcygeus and pubococcygeus. So most likely we will ask you to label specifically lah, rather than general. Okay. So this is just showing you the gluteal region where the sciatic nerve is found. Okay, so this is the piriformis muscle. So below the piriformis muscle is where the sciatic nerve can be found. Okay, they both exit the greater sciatic foramen. Remember the pelvis that I showed just now? So this greater sciatic foramen here, so the piriformis muscle and also the sciatic nerve comes out of the greater sciatic foramen. It's actually the same thing lah, okay, but in different view, and this one obviously has all these muscles lah, this specimen. Okay, so imagine this is the greater sciatic foramen of the pelvis with the piriformis and sciatic nerve coming out, and all these pudendal nerves. Okay, so these pudendal nerves will exit the greater sciatic foramen and insert the pelvis area into the lesser sciatic nerve, lesser sciatic foramen, to supply the perineum area. Okay, so but here you can only see clearly the piriformis and sciatic nerve lah. I think in MSK also in gluteal region lecture, we taught you this. Just a recap.
Doctor, in the book we were given, the arrow was pointing towards the obturator internus muscle.
Oh, okay, another arrow, is it? So this is the obturator internus lah. Here, oops. So this is the obturator internus muscle. Okay. So I think for this you can answer on your own. We will only discuss the labeling lah. Okay, that's more important in practical anyway. Okay, so this is the anal-rectal junction. So this is the rectum and this is anal canal. Okay, and then we have the external anal sphincter here. Okay, and this is the internal anal sphincter. I think not to worry about this blue and pink area here. This is just a representation of hemorrhoids. We do have some models that have disease as well lah. Okay, so this is just hemorrhoids lah. Okay, and from an external view, so this is the rectum, the anal canal down here. So this would be the levator ani muscles. And then we have the deep part of the external sphincter and the superficial part of the external sphincter, and also the subcutaneous part of the external sphincter. So just showing the different parts of the external sphincter lah. Okay. So as for perineum, we have the urogenital triangle here and also anal triangle. This is the anal canal and the liquid fat pad. Okay, the inferior view of the perineum in a male. So we can see this is the bulbospongiosus and this is ischiocavernosus. This is the superficial transverse perineum, perineal muscle. Okay, and then this is the anal canal and this is the ischiorectal fossa. Okay, in female, similarly, it has this transverse perineal muscle or superficial transversus perinei. Okay, and then this is the anal canal. This is bulbospongiosus here and ischiocavernosus at the side lah. Okay, so anterior view of the pelvis. Actually, it's a bit confusing, this picture, because parts have been cut to show the different layers of the pelvis lah. Okay, so if you imagine the outermost layer will be this perineal membrane, and then we have this transverse perineal muscle, and behind the muscle we will have this pelvic fascia. So the layers from outer to inner lah are these three layers. And then this is just a representation of the internal pudendal artery. Okay, so from inferior view is the same specimen, but showing the inferior view, just to show you the layers again. So we have the perineal membrane, which is the outermost, and then we have the muscle here, and then the pelvic fascia. Okay, just to show you the layers in represented by this model lah. Okay, so here this is a plastinated specimen. I think just from the inferior and back view lah. Okay, so you can see this is the ischiorectal fossa and obturator internus muscle here. Okay. Not very clear, unfortunately, so don't worry, we will not give this type of questions in the practical exam or in the OSPI, VIQ, sorry. So yeah, we kind of just took pictures of what we could find in our lab lah. Okay, so if we move on to the female reproductive organ, so we have this model here showing this uterus. Okay, and this is the round ligament of the uterus. This is the fallopian tube with the fimbriae and the ovary here lah. Okay, this is a plastinated specimen, so an actual uterus from a human being plastinated. Okay, so this is the uterus here, and this is the ovary. Not very clear. Again, if you do the practical face-to-face, you can actually orientate the object and see in a 3D view. But here, you kind of have to imagine a bit lah. Okay, so this is the suspensory ligament here. So this is the broad ligament and the round ligament of the uterus. Okay, I think the same specimen, but in a different angle. Okay, so this is the ovary. Okay, and the fimbriae, you can see the fimbriae here. This is the ampulla of the fallopian tube, the isthmus of the fallopian tube, and this is the uterus lah. Okay. So if we do a sagittal section of the pelvis area, okay, this is your spine at the back. Okay, so this would be your rectum here, okay, an anal canal. So in front of the rectum, you will find the uterus, okay, and then in front of that, you will find the bladder, okay, and this is the pubic symphysis. So together with the uterus, you will find the cervix and vagina. Okay, for male reproductive organ, if we do a sagittal section, so midline section, so again from this is the back and this is the front, or anterior and posterior. Okay, so we have the rectum here. Remember, when you do a digital rectal examination, you can feel an enlarged prostate. So the prostate sits in front of the rectum or anterior to the rectum. So this is the prostate gland. This is the seminal vesicle. The seminal. What do you call it? I'm lost of words. Not the seminal vesicle, the ductus deferens, the vas deferens joining the ejaculatory duct here. Okay, and this is the bladder. Okay, so this is the prostatic urethra, the urethra inside the prostate. Okay, and this is the symphysis pubis. Okay, and this is corpus cavernosum in white, and this is corpus spongiosum. Again, we know that it's corpus spongiosum because it has this spongy urethra inside. Okay, so if we move on to the next part here, this is mainly to show the different parts of the urethra. Okay, so we have this prostatic urethra here inside the prostate, and then we have the membranous urethra and spongy urethra. Membranous urethra is just this small part here lah. Okay, and then we have the glans penis here and the corona, and this is the ejaculatory duct lah, where the seminal vesicle and vas deferens join to form this ejaculatory duct. Okay, so the same model, we can do a coronal section of the penis. So you can see a cross section showing this corpus spongiosum with the spongy urethra, and also corpus cavernosum, and you can see again this corona and glans penis lah. Okay, more on male reproductive organs. So just to orientate you, so this is the bladder. This is the prostate, again prostatic urethra here, membranous urethra, and spongy urethra here lah. Okay, but in this particular model, we can just see some representation of seminiferous tubules, epididymis, and testis lah. Okay, so here we can see this would be the testis and head of epididymis. This would be the vas deferens. Okay, everything will be inside your spermatic cord lah. Everything here will be in the spermatic cord, but here the fascia has been removed around it lah. Okay, so here I think the scrotum is still intact, and the spermatic cord is also still has some layers here. Okay, and this is the remaining vas deferens. Okay, these actually we just wanted to show you what the actual specimens look like, but we won't ask you specimens like this where you can't really see the structures clearly. So just for your own macam learning, we like structures like this also we will not ask you because it's not very clear what the structures are. Okay, usually we will just ask just to show you what the models look like and what the actual specimens look like. So we give you different pictures of the organs lah. Okay, so here as well we can see this is the inguinal ligament. Okay, and this is the scrotum, and this is the glans penis lah. Okay, that all?
Doctor?
Yeah, I think that's all.
In the book, it labeled just above the glans penis. So what is that called?
This area here would be corona lah. You mean it's moved, is it?
Yeah, the label moved it a bit upwards.
Here.
No, even more outwards, like the root
here
instead.
The center.
Yeah, so just even if you label penis only, we will accept lah. But I think the more obvious structure here would be the glands lah. But if it's labeled different there, you can just label the penis lah. Okay, I think we didn't have much actual specimens of the male reproductive system, so that's why we had a better models lah in showing the different structures. Okay. So yeah, I think that's all for the gross practical. Can you take the attendance?
Dr. Hafiz said only one attendance
Oh, okay. One attendance enough.
since we combined both classes in 1 hour.
Okay. Okay then. So thank you very much. I think Dr. Sarah will see you tomorrow for your practical assessment. Okay. So thank you very much. Yeah.
So tomorrow at 9, is it?
Has Dr. Sarah contacted you or not yet?
I think not yet.
Not yet. Maybe Jonathan, can you ask Dr. Sarah? I'm not sure if it's at 9 or 10 because you have a briefing about coming back at 11:30, right? I think you have a briefing about like protocols of coming back to campus or things like that at 11:30. So I'm not sure what time she will do the practical, whether 9 or 10. Can someone contact Dr. Sarah and confirm the time?
Okay, doctor.
Okay. Okay, so thank you very much. All the best for your assessment tomorrow. I think that's all. Okay, thank you.
Thank
Thank
you,
you, Doctor.
doctor.
Thank you, Doctor.
Doctor.
Thank you,